we're going to move on to our final talk for today. We're going to hear from an all-star volunteer with the Alzheimer's Association, Lauren Snyder. Lauren was born, raised, and still lives in the rural community of Penn Yan. Lauren's a nurse who retired after 33 years at Yates County Public Health, 28 years as the director of the department. Lauren volunteers in so many ways to help her community, and facilitating Alzheimer's Association caregiver support groups are one of the highlights of her volunteer activity. So it's my pleasure to introduce Lauren Snyder, and she's going to talk with you a little bit about the Alzheimer's Association and her experience as a volunteer. Take it away, Lauren.
All right. Thank you, Tara. Hello, everyone. I wish I'd had the opportunity to listen to all the presentations that you've already heard today. I caught a little bit of Eric's, and it was a wealth of information, as somebody else said. I wish I could have heard all of it. As a volunteer for the Alzheimer's Association, as Tara mentioned, I'm really honored to have been asked to talk a little bit today to sort of wrap up your day, talking about the Alzheimer's Association, some of the services and programs that they have to offer, a little bit about dementia, and a little about my story and my family. So next slide, please. First, let's take a look at the mission of the Alzheimer's Association. And it's very true that the Alzheimer's Association does lead the way to end Alzheimer's and all other dementias. And they do that by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Next slide. The Alzheimer's Association works to achieve that mission in 6 different focus areas, or as they call here, strategic goals: providing and enhancing care and support, accelerating research, and I would add that that is worldwide that they do that, provide support for research, increasing concern and awareness, strengthening diversity, equity, and inclusion, advancing public policy, and increasing revenue, raising funds for all this work. Next slide. The Alzheimer's Association is a source of a wealth of information about Alzheimer's and other dementias. If you have interest in finding any of the facts and figures, you can go to the website 2024alzheimers.org/facts. But I especially want to point out to you from this slide that nearly 7 million people in the nation are living with a diagnosis of dementia, of Alzheimer's, I should say. And approximately 11 million people are caregivers, unpaid caregivers for folks who are living with Alzheimer's. Those numbers are absolutely astounding to me. Next slide, please. One of the most frequent questions that we get is, what in the world is the difference between dementia and Alzheimer's? And I don't know if this has come up already today, but let me just briefly tell you that dementia is really that umbrella term that sort of talks about, or not talks about, it represents a loss of memory, changes in thinking that really interfere with how a person lives their life. And it is true that Alzheimer's is the largest share of those dementias. Somewhere in the range of 60 to 80% of folks living with dementia are actually diagnosed with Alzheimer's. And there are other types, as you see here, like Lewy body dementia, vascular dementia, frontotemporal dementia, and others, such as Parkinson's, that dementias that come with Parkinson's or Huntington's sometimes. Not everyone who has those diagnoses actually develops a dementia. And there is also a form called mixed dementia, which could be a combination of any of those that we've already mentioned. We're not going to go, we don't have the time to go into the details about any of those types of dementia, but just wanted to let you know that there are those there's that range, a variety of diagnoses of dementia, Alzheimer's being the bulk of them. Next slide, please. And still looking at facts and figures, it is worth mentioning that just here in New York State, we have over 425,000 people who are age 65 and older who are living with Alzheimer's. The next slide. The Alzheimer's Association is really in the business of trying to make a difference in our communities and to assist families and individuals who are dealing with dementia, in particular Alzheimer's. But I really think it's important to point out that even though Alzheimer's is in the name of the association, that the services are available to individuals and families with any form of dementia. So next slide, please. How does the Alzheimer's Association help in our communities? The first thing, next slide, please. The first thing that I would like to mention, and this is amazing to me that they're able to do this, is to have a 24/7, every day of the year helpline, 800-272-3900, that is available every single day around the clock. And it's staffed with master's level clinicians. Just amazing to me that that's true. But that phone number will get you to someone who can help, can provide information, steer you in the right direction, whether you are somebody living with dementia, you're a caregiver, you're a professional, just somebody in the public who has a question. And it doesn't matter. Like I said, it's 24/7. If it's the middle of the night, that's okay. Make that call if you need to talk to somebody. Another thing the Alzheimer's Association provides, and everything they provide to us, to families, is free. They also have a wealth of free education. There is almost every topic you can think of. If you go to alz.org, you can find a great deal of information about Alzheimer's and other dementias and other topics that you might like to find out about. The Alzheimer's Association also has something, if you're looking for services in your own community or to find out what the resources are right where you live, they have something called Community Resource Finder. You can go online to that site, communityresourcefinder.org, and you will find all kinds of information about your area. And if you're working with folks who don't typically get on a computer, I know so much of this stuff is like web-based, but some people for sure out in rural areas either don't have the ability to, they don't have a computer, or they don't have the connection for their computer to be able to access some of this information. Calling that 800 number is a fine way for them to get the information they need. Next slide, please. As I said, what the services and support that the Alzheimer's Association provides is free. And we've already talked about much of the stuff that can be provided online. But that education can also be provided in person. And there are many education sessions that can be offered in the community. That can be to an organization, it could be to an individual, to a group of caregivers. That free education is available to anyone. And besides going to the alz.org/education, it's possible to call and request an education session on a variety of topics. Next slide, please. Another interesting service that the Alzheimer's Association provides is something called early stage social engagement. And this is really what it says. It's providing some social events that are still going to work for someone who is in the early stages of their dementia and usually includes the caregiver as well. But this can be some really fun things like going to an art gallery together, going to a concert. Could be something just as simple as having a monthly coffee at a cafe. This is really social activities that help to retain some of those social skills by practicing them in a really safe situation for the person with dementia and also for the caretakers. Next slide, please. Now here's something that I'm involved in as a volunteer. I'm a facilitator for a couple of support groups here in Yates County, where I live. We meet monthly, and the support groups are intended typically for caregivers, sometimes for folks with dementia, but generally speaking, they're for caregivers. One of the things that that I would want to tell you is that you can find these support groups in almost any community. And it is really a huge help to the caregivers to share their stories with each other, share their tips and their skills, the things they figured out. I don't know that there's anything that is really more of a support for people than sharing with others in the same situation. There are also some very specialized groups, support groups. For example, there's men's group, women's groups. You probably could find anything that you wanted. If you would call the number at the Alzheimer's Association and find out where those support groups are. Next slide, please. Now, if you're somebody who's wondering how you can help, there are very many ways that you can do that. You can help as an individual. You can get involved in doing things like say the support group, like I'm doing. You can also, as a business or an organization, you could get involved with the Walk to End Alzheimer's. You could host an educational program for your employees, for example. And you can certainly help your community just by sharing some of the information that you have learned here today and getting that word out. Next slide, please. You might be wondering how in the world the Alzheimer's Association manages to provide all of this support, all these programs. Where does the money come from? Well, two of the largest fundraisers for the Alzheimer's Association are the Walk to End Alzheimer's and something called the Longest Day. First, let me tell you about the Walk to End Alzheimer's. I think you could, again, probably find that in, it says 600 communities nationwide. So you're probably, wherever you live in the US, you probably would be pretty close to a walk. And this is like most walks that we're all familiar with. If you sign up, you can do it as individually or as a team, and you get sponsors. That's how you raise money. And then you gather together, and the camaraderie, the support that you get from that gathering of people and walking together is huge. So it's not just about the money, even though that's a very important thing, but it's also about the people coming together. Next slide. So the second large fundraiser that volunteers are involved in is called the Longest Day. And as you might guess, it's June 21st, the summer solstice, because it is the day of the longest time of light. And in this situation, it's really up to the volunteer, or the family that's volunteering, to come up with their own fundraising event. And as you can see from the slide, it could be a variety of things. You can kind of pick what works for you. So a golf tournament, kids doing a lemonade stand, or maybe a dance competition. Whatever works. Next slide. So I've told you a little bit about the association, some of the services they provide. and supports that they give, a little bit about how funds are raised. Now I want to introduce you to my family. This is a picture of my family members who were able to participate in the Walk to End Alzheimer's last year, 2023. In this region, there are 3 walks. There's one in Rochester, there's one in Canandaigua, which is the one we participate in, and there is also one in Watkins Glen. This group, my family, is called Arlene's Army. We're called that because Arlene was my mom. My mother's been gone 10 years this year, as a matter of fact. Probably 5 or 6 years ago, we decided that we wanted to participate as a family in the Walk to End Alzheimer's. And this is about giving back. It is about giving back to the association and the sports we had from them. But it's actually more than that. First, let me tell you a little bit. My mom was diagnosed in 2000, and she passed away in 2014, late 2014. In the first probably half of that time, the first 7 years, it went pretty well. It was something that we talked about incessantly, but it really went fairly well. And my mom always said, I have lots to live for. In 2007, halfway through all this, my dad also had some health issues come up. And over the last 7 years of that period of time, as a family, we were caring for both of them. And what I really want to tell you is that as a nurse, I happen to be a nurse too. I guess Tara mentioned that to you. But as a nurse, I thought I knew about dementia. I really did. But let me tell you that until you have a dementia, someone you're caring for in your family, I don't care what your professional experience is, you really don't know dementia. It is a huge challenge for families. And honestly, that is why we first got involved in this Alzheimer's Walk. Not only did we want to give back to the association for any support and education we got while we were going through our own challenge, and that's what I usually tell people, but the truth is that the other reason is because we recognize the challenge that other families are facing, and we really want to do anything we can to help that. That's also why I got involved in facilitating the support groups, because I want to do everything I can to support other families in the challenge they're facing. And the third reason I'm a volunteer is something that always gets mentioned at the walks, and that is, this makes me teary, so hang on, folks, that one day we hope somebody will survive Alzheimer's. Next slide, please. And that is really the vision of the Alzheimer's Association, that we will end up with all of this wonderful work with a world without Alzheimer's and other dementias. So thank you all very much for giving me this opportunity. I'd be happy to answer any questions. Oh, you know what? I missed something, Tara.
What'd you miss?
I missed saying that if anybody wants to be a volunteer, they should go to alz.org. /volunteer and learn more about being a volunteer for the Alzheimer's Association. I'm sorry, I got a little carried away there with my family's story.
No, not at all. Don't apologize.
Okay. I do also want to say, just to follow up on the volunteer piece of it, is that the Alzheimer's Association, our Rochester Finger Lakes chapter, has outstanding staff, but they can't do it alone. They truly, truly need volunteers. So I encourage anybody out there who has has an inkling that they want to be a volunteer to look into that. Thank you.
Lauren, we cannot thank you enough for being here today, for sharing your story. Your passion for this work comes through. We really, our hearts go out to you, and we want to thank you for all that you do. I'm not sure if I made it clear, but not only is Lauren and her family walk champions for their history and the fundraising that they have done through the Walk to End Alzheimer's, but as she mentioned, she also spearheaded starting 2 new support groups in Penn Yan. One is in Penn Yan and one is in Dundee. So very much a champion in our rural area as well, providing those support groups for people who need that and always giving back. So Lauren, thank you so much for being here and for sharing the
pleasure.
presentation today. We really appreciate it. I'm not seeing any questions, but I do appreciate that you shared the website. There's a lot of comments coming into the chat of people expressing thank you to you for being here and for sharing your story and how meaningful it was to them, and all kinds of hearts and thumbs up and positive reactions
Thank
for
you,
you.
everyone.
So from all of us here in the Rochester and Finger Lakes area to you, thank you for all that you do for us and for sharing the mission and vision of the Alzheimer's Association today.
Thank you. You're
Have a
welcome.
good weekend.
Thank you, you too.
Thank you.